Our post-rehab tip for this month is being able to identify impingement. Now, I'm not saying actually go out and make a diagnosis, but a lot of times we get clients that are referred for post-rehab programs that are diagnosed with impingement, but there are three things that look like impingement, and if we don't know specifically what's going on, it can make a huge difference with the exercise programs. The three things that look like impingement are the following: bicipital tendinitis. Okay, so our biceps tendon becomes inflamed. Also, we can have an AC joint sprain that'll look just like impingement syndrome. And then the third thing, obviously, is impingement itself. So there are actually two things that look like impingement, but those two things are going to give us the same characteristics as impingement. Those characteristics are the following: the painful arc. The client lifts the arm overhead, and they have pain anywhere from 70 to 120 and above. Now, a couple key things here. When we see AC joint sprain involvement or strain involvement, what we're going to see here is the client has pain in this painful arc, but it's up here anywhere from 135 and above. With bicipital tendinitis, the client is going to have pain anteriorly, and the way we identify if they have bicipital tendinitis is we use a test called Speed's test. Let me get Jan to turn to the side here, just right there. We're going to ask the client to make a fist, place the elbow at 90 degrees, and bring the arm into slight shoulder flexion. What I'm going to try to do is straighten her elbow and also push her shoulder into shoulder extension. So I'm trying to do the following. Just relax for me. I'm trying to extend her elbow and move her into this position. I'm going to ask her to resist that, and this is placing our biceps into a situation where it's actually performing a dual role. It's maintaining elbow flexion, and it's also maintaining shoulder flexion. What I'm going to do here is apply resistance downward, and that resistance, again, is going to make her work the elbow flexion portion and the shoulder flexion portion. If the client complains of pain right here in this region, and they say that is the pain they're having, then we know they don't truly have impingement, they just simply have bicipital tendinitis. So again, this is called Speed's test. S-P-E-E-D''S. We just simply apply resistance, and we ask the client to hold. I'm applying resistance to the elbow flexors and also to the shoulder flexors. Now, what happens here is the bicep does double duty. It maintains elbow flexion, and it also assists with shoulder flexion. If she has pain there, then we know for sure that she has bicipital tendinitis. For that client, you can relax. For that client, we stay away from any type of bicep curl activities. For our client, as we said earlier, that has pain above 135 degrees in the painful arc, for that client, we stay away from overhead activities. There aren't any real exercises we can use to improve the situation here with the AC joint sprain, because there are no muscles that truly cross that joint. The supraspinatus crosses underneath. For our client that has pain in the painful arc, 70 to 120, they don't have any pain above 135, and they do not have any type of bicipital tendinitis issues when we look at Speed's test. For that client, they truly have impingement syndrome, and one of the things we need to do for that client is the pendulum exercise to open up the subacromial space. The second thing we do is work on internal-external rotation, and the third thing is to work on strengthening the posterior shoulder girdle. So again, when we get a client that's referred to us with impingement, one of the things we need to be able to do is make sure it's truly impingement and not an AC joint problem and not bicipital tendinitis. This isn't diagnosing, it's just making sure that we don't have these other things involved, which in turn can make the situation worse if we select the wrong exercises.